Health Novo presents Sushruta, our health awareness channel.
What are advanced gum diseases? Let me tell you, if you don't clean your teeth properly, the plaque gets accumulated. And if you don't remove that plaque properly, tartar forms, and that tartar which goes inside the gum can give you advanced gum diseases. Now let's see on this picture from tartar to advanced gum diseases. This is normal gums which you see in a healthy mouth which is pink in color. There is no bleeding on brushing, there is no bleeding on sucking the gums, no bleeding while eating apple, nothing. When the plaque accumulates, which is a thin film with bacteria of the mouth, and that plaque sticks at the junction of your gum and the teeth, and if it is not removed, it gets converted into tartar, which is a hard substance. The tartar contains the calcium and minerals which are available from the saliva. And that's the reason you see more tartar inside rather than outside. And that's the problem, that people, it is inside, so you don't brush from inside properly, and the tartar becomes more and more. As the tartar becomes more and more, the gums get swollen, they start bleeding even without brushing, because the tartar has gone down. The periodontia, which is between the root and the bone, this is periodontia get damaged. The bacteria go into the periodontia, and what as a dentist we call is periodontitis. Inflammation of the gums is gingivitis. When the periodontitis takes place, your teeth starts bleeding anytime, or it smells because there's a lot of infection set in. It goes more inside, and then you can see the teeth start shifting. There's a gap between the teeth. You don't see that gap initially because that is filled with tartar. Your teeth are not mobile even if the bone loss is there, because the tartar is holding the teeth. The moment we dentists remove the tartar, you see the gap, and you complain that dentist, after cleaning, I got a gap in the teeth. After cleaning, the teeth start moving. But let me tell you, friends, teeth become firm after they become healthy. Initially you find they are moving, but sometime later they become firm. But advanced periodontitis, what we call in your terminology is pyorrhea. Now how does it happen? Why it happens even if sometimes you go to a dentist and clean it? I'll show you another picture. This is the crown, that is what you see in the mouth. This is the root. And between the root and the gingiva gums, you see tartar here. Usually get your teeth cleaned superficially. There's a terminology, people have developed what you call deep cleaning. If that is not done, the tartar starts accumulating more and more. There's a swelling in the gum, and the bone recedes, and you get a disease called periodontitis. Sometimes the bone, you can see the bone loss here. You can see the gums have a problem. Only cleaning is not sufficient, but you have to treat the gums also. So in periodontal disease, patients don't get pain. Then you do home remedies, you see gargling, somebody says use this, somebody says use that. But let me tell you, friends, physically removal of tartar is only going to help you. This tartar between the gum and the tooth is like a thorn in your finger or in the foot. Unless we remove the thorn, the pain is not going to stop, even if you take any painkillers or antibiotic. So physical removal of the tartar is very, very important to avoid periodontal disease. But if you don't go to dentist even when there is a periodontal disease, then your tooth just falls off without any pain. And there are a lot of patients, not in the cities, but in smaller towns, there are a lot of patients that teeth has just fallen like this. That's what they say. There was no pain. But friends, when the bone loss, then the construction on that replacement of the teeth is also a problem, because we don't have a base. We can't do dentures properly, we can't do bridge, we can't do implant. So only thing is that to avoid periodontitis is to clean properly and check your teeth every 6 months.